Good day, everyone. We are BSN 3A for BSN 3D, and we are here to present our research study entitled Awareness and Practices on Occupational Safety Among Street Sweepers. I am Micaella Maraña, and together with me are my co-researchers, Alessandra Lanzar, Elaisha Mamawan, and Micaela Maravilla. Street sweepers play an important role in maintaining cleanliness and sanitation within the community. Despite the importance of their work, they are continuously exposed to occupational hazards such as dust, harmful waste materials, sharp objects, pollutants, and extreme weather conditions. This exposure may place them at risk for respiratory illnesses, infection, health-related disease, and physical injuries. Although street sweepers are frequently exposed to these hazards, there is still limited research focusing on their awareness and actual safety practices while working. Because of this, the researchers become interested in determining whether awareness influences the occupational safety practices of the street sweepers.
The objectives. This study aimed to determine the level of awareness and occupational safety practices among street sweepers. Specifically, this study aimed to describe the demographic profile in terms of age, sex, educational background, and years of service. Second, determine the level of awareness regarding occupational safety. Third, identify the safety practices performed during work. And fourth, determine if there is a significant relationship between awareness and safety practices. Through this study, the researchers hope to provide information that may help improve occupational safety programs and promote healthier working conditions among street sweepers.
This study utilized a quantitative correlational research design. This design was used to determine the relationship between awareness and occupational safety practices through the use of numerical data and statistical analysis. For the study sample, a total of 106 street sweepers participated in the study. The participants were selected using purposive sampling from Barangay Mandalagan, Barangay Alihis, and Barangay Villamonte. Only those who were actively working during the data collection period were included. The study used a modified questionnaire divided into 3 parts: demographic profile, awareness on occupational safety, and safety practices. The questionnaire focused on occupational hazards, personal protective equipment or PPE, hygiene practices, and proper waste handling. A 5-point Likert scale was used to measure responses. The instrument was validated by experts and obtained a Cronbach alpha of 0.70, indicating acceptable reliability.
Results and discussion. For the demographic profile, the results showed that most participants were aged 41 to 50 years old, while only a few belonged to the younger age group. In terms of sex, the majority of the participants were female. Most of the participants had completed elementary, high school, or college education. For years of service, most had 1 to 5 years work experience, while only a few had more than 10 years of service. These findings suggest that the workforce is mainly composed of middle-aged females with varying educational backgrounds and moderate work experience.
In terms of awareness, the results showed a very high level of awareness with an overall mean score of 4.55. This indicates that street sweepers are knowledgeable about occupational safety, including hazards, risks, and safety procedures associated with their work. The highest awareness was observed in safety procedures, which means that participants are aware of how to protect themselves during work. Meanwhile, the lowest awareness was related to PPE provision, suggesting that there may still be limited awareness regarding support and protective equipment provided by the local government.
The level of practices. For occupational safety practices, the results also showed a very high level, with an overall mean of 4.57. This means that street sweepers generally comply with proper occupational safety measures. The most practiced behavior was proper waste disposal, which reflects strong compliance with cleanliness and safety procedures. On the other hand, vaccination was identified as the least practiced behavior, showing that some preventive health practices are less commonly followed. Overall, the findings indicate that street sweepers are able to apply occupational safety measures consistently in their daily work.
The study showed a strong positive relationship between awareness and safety practices with an R value of 0.78. The p-value was less than 0.001, which means the result is statistically significant. This means as awareness increases, safety practices also improve. The findings suggest that awareness plays an important role in influencing the occupational safety practices of street sweepers.
In conclusion, the study found that demographic profile does not affect the relationship between awareness and safety practices among street sweepers. The very high level of awareness shows that street sweepers are knowledgeable about safety practices, although awareness alone does not automatically guarantee proper behavior without reinforcement. The very high level of safety practices indicates that street sweepers are able to apply occupational safety measures constantly in their work. Most importantly, the significant relationship between awareness and practices shows that awareness directly influences safety practices. This means that as awareness increases, safety practices also improve. Therefore, awareness plays a significant role in shaping occupational safety practices of street sweepers.
Based on the findings of the study, the researchers recommend the following. For local government units or LGUs, occupational safety training should be strengthened, complete PPE should be provided, and regular health monitoring should be ensured for street sweepers. Street sweepers are encouraged to continue practicing proper safety measures such as PPE use, hygiene, hydration, and rest breaks. Health professionals and nursing students may provide health education, safety awareness campaigns, and regular community-based screenings. The community should practice proper waste segregation and disposal to reduce hazards and protect street sweepers from exposure. Lastly, future researchers are encouraged to conduct further studies with larger samples and use mixed method approaches to gain deeper understanding of the experiences and challenges of street sweepers. And that concludes our presentation. Thank you for listening.